Hawaiʻi News Now at 5.
And we begin with developing news tonight. Congresswoman Tulsi Gabbard is now calling on Governor Ige to declare a state of emergency on the Big Island as the number of dengue fever cases continues to grow. There are now 242 confirmed cases, including one new case today.
Our Mileka Lincoln just got off the phone with the representative. And Mileka, the big question, why is Gabbard calling for a state of emergency now?
Yes, Chris, Steph, Congresswoman Gabbard says an emergency proclamation from the governor is long overdue. She says residents and visitors of Hawaiʻi Island cannot afford to wait any longer for, quote, aggressive action that's necessary to combat the spread of this disease. Now, Gabbard is calling for several immediate changes to the state's dengue fever response, starting with completely free and accessible testing from anyone who suspects they may have the disease. Right now, she says folks are being charged for their doctor or clinic visits in order to get their blood drawn. The lawmaker also says a more thorough public information campaign is needed to not just spread awareness, but provide details on what residents and visitors can be doing to best protect themselves.
I'm strongly urging the governor to treat this like the emergency that it is, deploy these resources now so that we can be proactive in putting an end to this dengue fever outbreak and prevent something far worse from happening.
Now, Congresswoman Gabbard says Hawaiʻi Island needs a full-time entomologist along with an appointed state coordinator to ensure the outbreak doesn't become endemic and reach other islands. She says at the very least that requires additional vector control staff to spray more areas and a more comprehensive distribution of traps to prevent the spread of mosquitoes. Congresswoman Gabbard says her greatest fear is that dengue fever will become a statewide health emergency. And she says that would have devastating social and economic implications. We reached out to the governor's office to ask if he'd be declaring a state of emergency, and we were told no such plan for announcement at this time was in place. That said, we just heard from Hawaiʻi County Civil Defense Director Daryl Oliveira, and he tells us that he believes an announcement is pending. It's just a matter of time. You'll hear more from him coming up on KGMB at 6. Mileka Lincoln, Hawaiʻi News Now.
Well, we're certainly concerned, and we are having surveillance to make sure that, Zika and other diseases does not come into the islands.
The Centers for Disease Control says Hawaii's response to the dengue fever outbreak shows it's not ready for another more dangerous mosquito-borne disease like the Zika virus. The CDC has issued a report saying the Department of Health is understaffed and lacks the resources to handle another outbreak. Lynn Kawano joins us with more on the response by state health officials. Lynn.
Chris, the state isn't surprised by the report. Budget cuts have forced the DOH to slash the number of vector control workers from 52 to 26 in recent years. The department is now asking for some of those back immediately to help get dengue fever under control and to prepare for Zika.
The Centers for Disease Control and Prevention made it clear Hawaii needs more resources to handle mosquito-borne illnesses. The dengue fever outbreak has hit record numbers, and a CDC review of the state's handling shows a lack of technical and general staffing capacity at the Department of Health. The federal agency was concerned that current resources are taxed and there is limited surge capacity if another health event arises in the state. That health event, mosquito-borne diseases such as Zika are likely and will require expertise at the State Department of Health that currently does not exist. Zika is a much more dangerous mosquito-borne illness that causes birth defects if a pregnant woman is infected.
Brazil is dealing with Zika, and because it's such a catastrophe there, they're talking about utilizing 220,000 troops to make sure that they get rid of all the possible vectors, and they've told their people, it's my understanding, to not get pregnant.
State Senator Josh Green, who represents the Big Island, says lawmakers are working to get the Department of Health what it needs to fight dengue and prepare for Zika. The deputy director of the Department of Health says he would welcome any help. Keith Kawaoka is hoping to get a total of 10 positions added to the budget now at a cost of $500,000.
We are taking measures to actually identify positions right now that either we can get positions from other departments, for example, or to do some emergency hiring in some regard.
The 10 positions he wants now would include 8 vector control workers, 1 more epidemiologist, and a person to help with communications to get the word out. The health department will look to the governor for that immediate help. I'm Lynn Kawano, Hawaii News Now.